Dr. Jeff Kirby was a member of an expert panel advising the government on medical assistance in dying, or MAID, but he stepped down last year. He's a retired professor from the Department of Bioethics at Dalhousie University. Dr. Jeff Kirby joins us from Halifax. Welcome to the program.
Thank you.
Dr. Kirby, you stepped down from the expert panel that was advising the government on this question of mental illness and medical assistance in dying. This was in the spring, before the panel actually delivered its recommendations. Why did you feel it was necessary to step down?
Yeah, I decided to step down at the very last minute, actually, because I couldn't in good conscience sign off on the report, the recommendations that the expert panel submitted to the Joint Committee.
You say in good conscience. What was weighing on your conscience?
Basically, I thought the mandate, I understood the mandate to be, and the rest of us did, that it was to produce guidance and protocols for use, but also to provide recommendations regarding the development and use of legislative safeguards, which were amendments to Bill C-7.
So there is a fair bit of process in what you just pointed to there, and I really want to keep focused on, you know, this is about a life or death decision. What is it that you didn't believe was getting communicated to the government, or that the government wasn't hearing?
Yeah, essentially, I didn't think that it adequately would cover off the interests of persons with mental health disorders who were members of disadvantaged social groups. I thought that the recommendations were too soft and not strong enough in that regard. So, for example, I was strongly advocating that one of the MAID assessors should be an independent psychiatrist in these circumstances. Mm. And the reason for that is that, you know, essentially psychiatrists are the only health professionals that are properly trained in terms of doing complex capacity assessments in these circumstances, in terms of evaluating irremediability of the suffering of people with psychiatric disorders. And they're also the only specialists that can really do psychiatric confirmations of the diagnosis, et cetera.
So right now, sorry, I was just going to say, for the audience's sake, that right now it's doctors and nurse practitioners who fill that role, but the recommendations from the expert panel, recommendation number 10, does involve that one of the assessors be a psychiatrist. That didn't meet the bar for you?
Yes. Yes, it's not quite enough in the sense that it's a soft recommendation. So the way it is, it's just a guidance recommendation. So there's no requirement for the medical regulatory authorities of the provinces and territories to follow that recommendation. So it's only if you put it into a legislative amendment would it be that it'd be guaranteed that all provinces and territories would follow that recommendation in the future.
So what's your fear? What are you afraid is going to happen when Canada makes this move?
Well, it's a bunch of things, but if we stick to the primary example of an independent psychiatrist being one of the assessors in these circumstances, I am concerned that when these cases are allowed to be reviewed in terms of requests for MAID, that unqualified people will be assessing them. So I don't believe that a generalist like a family doctor or a nurse practitioner who's not a psychiatrist, you know, is trained well enough to actually do the assessments. So I'm concerned, you know, about the safety of people with mental health disorders, that they'll be overrepresented represented in terms of requests and in terms of implementations of MAID.
What I hear you saying there is that you're worried that people with mental health disorders are going to die in significant numbers when they shouldn't be approved for medically assisted death. Is that correct?
Yeah. I wouldn't say significant numbers, but I think more will actually be approved for that are actually should be qualified for it. I believe that my own view is that there is a small subset of psychiatric patients with profound, enduring psychiatric suffering that would meet the requirement and the sub-criteria in a serious and grievous medical condition. But there's a lot of other people who perhaps wouldn't. And I'm thinking that some will get through because the diagnosis is incorrect, or they haven't assessed the capacity correctly, or they haven't done a good evaluation of irremediability in terms of the suffering.
The fact that the government is seeking an extension on this, and we don't know how long that extension is going to be. This is a commitment they made towards the end of the year. Does that suggest to you a step in the right direction? Does that give you any comfort, I guess?
Well, I kind of, like the fact that they're doing this delay, but I think the only value that I see in it so far would be that they'll make sure that the education modules for assessors and MAID providers in this particular context will be ready. Such education modules should include components with cultural safety and trauma-informed care, et cetera. However, I don't see any, kind of message from the government that anything's really going to change. They're just going to delay the time of implementation. They indicated, it's a joint committee response to, in response to the expert panel, et cetera. The government indicated around that time in late October that they had no intention of making any legislative amendments to Bill C7. And I suspect that remains the same. They'll just run out the time with the same soft recommendations, and then it will be approved eventually later next year, the year after.
You flagged that you believe the consequences of that could be quite serious. I do want to ask you about the other side of the coin, though. You mentioned a moment ago that there are instances where you think that people who only have a mental illness, not a physical ailment, should be eligible for medical assistance in dying. I want to read to you a bit of what Conservative leader Pierre Poilievre said when he was asked about this question recently. He said, "Conservatives do not believe that medical assistance in dying is a solution for mental illness. Conservatives believe that we should provide mental health care to people to improve their quality of life, help heal the psychological wounds that are afflicting them rather than giving up." What's your response to that?
Yeah, I think that's somewhat misguided. I think for someone that isn't aware of medical practice, et cetera, and the culture here. But essentially, it would be discriminatory, I feel, to not grant requests for MAID for persons who have a sole qualifying condition of a mental health disorder when you're already with Bill C7, allowing requests for the same sort of circumstances with suffering that's based on a physical health disorder. Now, I'm talking here about the category of MAID requests where a death is not reasonably foreseeable.
Okay, I only have a moment left with you, and I do just want to ask you as a closing thought for Canadians who are, undoubtedly concerned about what you just said, that you're not sure that this new regime is really going to provide adequate protection is fundamentally what I hear and what you're saying, at least for a small number of people. There are already concerns about the existing regime that is in place. What do you want to leave Canadians with as a closing thought about how well we're doing in this country when it comes to medical assistance in dying?
Well, I think overall we've been doing pretty well. It's been kind of a rapid regime change and protocol change, but I think we've done fairly well in terms of since the, Bill C14 was approved. There's been rumbling along pretty well, and things have been happening with good people involved in terms of doing the assessments and the provisions, et cetera, and good oversight. However, with the introduction of Bill C7, a whole other set of considerations has to be looked at, has to be addressed.
Okay, well, we will be watching to see the extent to which they ultimately are addressed. We appreciate your time and your insight today. Thank you very much, Dr. Jeff Kirby.
Thank you. Bye-bye.